Okay, you're in the home stretch. The 10 rules of physician engagement. These are rules number 9 and 10. And we're going to start with rule number 9. If you want physician engagement, then listen to them when they are upset, because they are already maximally engaged and maybe harboring ideas worth considering. And for me, the lesson of this one was I was getting ready to leave on vacation. Just about out the door, my secretary said, "Hey, Dr. So-and-so is on the phone, wants to talk to you. He's really, really upset." I thought, oh, great, here we go. I almost wanted to make an excuse. I said, no, no. I mean, I've worked with him before. I said, I'll listen to him. Pick up the phone, and sure enough, I mean, it was just a half hour yelling and screaming, lots of f bombs. I mean, everything was going wrong, and I was just listening to him because I knew how he a lot of times he would do this. He would go off and sort of a rant, and you let him go for a while, and then he'd eventually calm down, and we'd have a rational discussion. And while he was doing this, though, I had a piece of scrap paper on my note paper on my desk and a pen, and I was just scribbling down some notes as he was saying things. I just every once in a while write down a few words and ideas and stuff, and didn't really think about it. And sure enough, he calmed down, and we started having more rational discussion. As I tell you what, we'll talk about this when I get back from vacation. And we both left on vacation on cordial terms, and I came back from vacation, and I was sitting around cleaning up some stuff on my desk and saw this piece of paper and started reading the stuff that was written down. And I thought, oh, wow, that's a great idea. And then it dawned on me, I know where this idea came from. It's from that surgeon who was yelling and screaming. I was so focused on what he was saying in terms of his words, his emotions, and particularly things that were not really easy to hear or listen to. And I thought somehow I completely missed that he was trying to communicate ideas. That, yeah, he was very passionate, he was very engaged, right? Maximally engaged, but he was also trying to communicate ideas. And not everybody has the best, sort of ways of communicating all the time. And this particular individual, as a general rule, he was usually pretty good, but every once in a while he'd get pretty hot under the collar. And when he did, I think a lot of times he doesn't realize this, that here he is trying to communicate something, but his passion, his anger is getting in the way of anybody focusing on it, right? I can't focus on the ideas because I'm too busy sort of listening to the F bombs and everything else that was coming out of his mouth at the time. But in all of that, I had somehow managed to write these ideas down and realize I had to learn how to put the filters on. And when I started putting the filters on, started listening to what people were really, really trying to communicate. And I don't mean necessarily all of the nasty language and things like that, but what are they trying to communicate? What they're trying to communicate is often underlying all that is a really good idea. And so you have to listen to it. It doesn't mean you have to take all these ideas and run off with them and do them, but as a general rule, you're going to find some real diamonds in the rough underneath all that stuff, and it's worth listening to. That gets physician engagement because despite all that, you manage to listen to them, and if you implement those ideas, now they realize that you're with them, right? You manage to put those filters on and listen to them, and that's really a hard thing to do, but if you can learn how to do it, guess what? You get engagement. So that's a good way to practice. Next time somebody comes in and is upset with you, just try to put the filters on and say, what are they really, really trying to communicate there? Because often, let's just face it, physicians get into this for all the right reasons. They want to take good care of patients, and that's underlying a lot of that sometimes angry behavior that you'll see among physician groups, or individual physicians. So put the filters on, look for the ideas. There's a pretty good chance you'll find them. So rule number 10, if you want physician engagement, then communicate with words that positively reflects the things they value. And so what I want to do is I want to come back full circle to our first example. Remember I told you about the hospital administrator who came in and was presenting something and basically got thrown out of the room by the Department of Surgery. They never heard what she had to say because her language was so disengaging. A month later, I brought it back to the group and I said, hey, by the way, I just wanted to tell you all something. We think we're impacting your hospital-acquired infection rate. In fact, actually, there's pretty good evidence that shows that it's probably related to the fact that our hand washing rates have gone up. We were looking at that recently. We saw a statistically significant increase in hand washing rates, particularly among physicians. And first off, we applaud all of you and thank all of you for doing that. But wow, I mean, this is fantastic. We are making an impact on patient care. Again, getting back to the things that they value, patient care, getting good quality, patient safety, those types of things. Start with that, lead with that. And then I got a chance to kind of mention what the rates were, and I also got a chance to talk about, hey, the things that have been done to help make it easier for people to wash their hands before and after they go in to see patients. So it was really kind of a great way to communicate a message. And here it was the exact same message our previous administrator had tried to get in to explain to the group, just different words. Same outcomes, same ultimately underlying same message. But when you use words and communicate in ways that with words that focus on the things that they value, they're more likely to listen to you. And not only that, what's interesting is they're more likely to walk out of there and go, hey, hand washing is a good idea. I need to be doing more of this on a regular basis. And so it also, I think, reassures people that, that this idea that that what they're doing impacts patient care. Not only that, but it's okay to track hand washing rates and things like that. So to me, it was a great experience because it really taught me a lesson. That is okay. How you communicate things is extremely important, and the words you use for the audiences you're using them with is really going to play a role in whether you get engagement or disengagement. And so this was a way to get engagement. So I'm just going to give you the shortcut. If I had to do a Reader's Digest version of this entire presentation, I'd say, look, it really comes down to two things. And the first thing is avoid disengaging language and behaviors, and I'd also add, and when you can, if you can't avoid it, then mitigate it. And that, to me, is sort of rules number 1 and 2. Focus on what your physicians value, and that's really basically what rules 3 through 10 were discussing, because that's how you're going to get their engagement. Trying to come in and say, well, this is the way it's going to be, and this is what we say, this is what we want you to do. That isn't good. To me, you might get some buy-in with that, but I think as a general rule, you're probably not. So again, these two simple rules, I think, are probably the things you want to carry in your back pocket with you anytime you go and talk to physicians, particularly when you're trying to get engagement. And if you need any more, or if you want it written down anywhere, I've done this both as a blog on my website, and that's the first bullet point there. And then the second one is I also wrote it as a LinkedIn article, so you can go in there and look in there if you want to see the more specifics of it. But I think you've heard everything I have to say on physician engagement, at least for right now. And breaking it down to those two final rules, I think that's a good one to carry away from this presentation. So I would really like to thank you for taking the time to listen to this presentation. I think it's an extremely important topic. And I think that if you have any questions, feel free to contact me at Dr. Terry Loftus at terryloftusmd@gmail.com or visit my website at loftushealth.com. Happy to take any questions and get back to you. And you have a great day, and think about physician engagement. Thank you.